Hello, Gunderson colleagues. There have been a lot of questions asking about Gunderson's position in response to Mr. George Floyd's death and the surrounding events. First, let me be clear. Gunderson rejects racism, hatred, abuse of power, and bias in all its forms. We stand strongly against those issues, and I want there to be no lack of clarity on that. We are in absolute support of those illuminating these issues in our community and the nation. Personally, I have had a range of emotions from anger, sadness, and hope. I admit I do not have the right answer or the words to comfort those in pain. From an organizational standpoint, we have grappled to find the appropriate response. You will note that we have not given a public statement in the community. There have been many examples of advocacy, and we want to support that. I've attended some of the rallies, and the leaders of those rallies are doing a really good job. They're keeping it nonviolent and are sharing poignant messages. I don't believe that Gunderson should jump in and say, "Hey, we want the megaphone now." We would drown out those voices that have long not been heard. So we want to be supportive of those voices going forward. A consistent theme I am hearing is please listen. We are asked to listen to understand and acknowledge pain and perspective. I believe the first step for Gunderson is to listen to more fully understand. I can see how listening might look like silence to some of you, but active listening is not inaction or silence. It's what we're being asked to do as a community. So we will listen to, support, and follow those who have been leading. As an expert in healthcare, we recognize the barriers leading to health inequity. Racial inequity is a public health issue. The coronavirus pandemic has demonstrated the dire consequences of this reality. We acknowledge the impact of social determinants of health in contributing to inequity. Our focus on these issues started years before today's crisis, and it is integral to our mission. Our strategic plan is designed to close the healthcare equity gap by educating about the traumatic effects of adverse childhood experiences, preventing and treating the epidemic of addiction, addressing homelessness and its causes, and building a resilient, trauma-informed community, all in collaboration with community partners. But this is only our baseline. We have to do more. All of this will take hard work and require honest introspection. Injustice and bias happen inside our walls as well, and inflicts unnecessary pain to staff, patients, and families alike. We cannot let this stand. We must be better. This will be uncomfortable, but a necessary journey to create an organization and community where all can flourish. We will honestly evaluate ourselves and create programs to improve. That's what we're called to do as an organization. I promise you that we will take this as an opportunity to accelerate our progress. I wanted to take this time to make it clear that we are not being silent. We do have a position, and we will continue to support those in our community who are leading and lending their voice. Thank you, and take care.